Thank you very much. Without much ado, we get going. I welcome Professor Krishnadat Chavali. He'll be the first speaker for the symposium, and he will be speaking on the historical background, plant introduction, and toxicological overview. Welcome, Dr. Chavali. He's also put a lot of effort to get this workshop and conference and symposium going. So, welcome.
लाइट्स फर्स्ट दो पहले लो बंद कर दो लाइट बंद कर दो A very good morning to all of you. I feel intimidated with so many luminaries sitting here, and I feel I am too I'll say a ignorant person to talk about anything related to this subject here. However, I'll try my best to be short, to be sweet as far as possible. And my topic is historical background, introduction to the plant, and toxicological overview of tobacco. Tobacco is not something new to us. It has been in use since so many years, in fact so many decades. Historically, this name tobacco has been thought to be derived from Tabaco. This is a place in Yucatan in Mexico, from where it is supposed to have spread to the whole world. Another thought is that probably it is from an instrument called tobacco, which was employed in Hispanoia for smoking of this weed. Tobacco has been in use by people for healing, for blessing people, as a form of barter, for exchange of goods, as a gift while welcoming guests, to honor them, or as an offering to those who are requested to pray or share their wisdom. In India also, tobacco has been advocated in Ayurveda as treatment for scorpion bite, as an antidote in poisoning for strychnine. So tobacco has been in use both medically as well as for the purpose of recreation. That is the dried leaf form of tobacco which is used. The plant itself is not one. Nicotiana tabacum and Nicotiana rustica, they are the commercially cultivated plants for their tobacco. In India, we have a separate plant, that is Lobelia inflata, which is grown for tobacco, that is Indian tobacco. Tobacco belongs to the Solanaceae family, the same plant from which we have tomatoes and potatoes, or the nightshade group of plants. And it is one of the most widely produced non-food crops in the world. So, like I have already said, it's a native of America, but now has grown all over the world, in fact, including our country. And there are two active principles in tobacco. This is common knowledge, nicotine and nicotianine. What probably I did not know and I came across while searching the literature was that there is another plant known as Duboisia hopwoodi, which is grown in Australia. It contains a active principle, piturine, which is a volatile alkaloid acting exactly like nicotine. That is the plant. And tobacco, as we all know, is used other than for medicinal purposes or for medicinal reasons. It is used for recreational purposes, for smoking in the form of smoking, sniffing, chewing, dipping. In India, we are not new to these things. Packets littered about everywhere in the form of snuff, gutka, kheni, mawa, pan masala, etc. Cigarette smoking is is the most popular forms of consumption of tobacco, and each cigarette, the cigarette contains more than 4,000 toxic chemicals, of which more than 60 are believed to be carcinogenic. Nicotine itself is very toxic. It exists in the whole plant, but especially so in the leaves of the plant. It is a colorless, volatile, hygroscopic, oily natural liquid, which is an alkaloid, turns brown and resinous on exposure to air. It has a burning, acrid taste and a penetrating, disagreeable odor. For this purpose, in fact, there have been uh, legislations against the use of tobacco in Great Britain, and it has been the King James of England. He speaks of tobacco as being a sinful and shameful lust, as a branch of drunkenness, and in conclusion he says it is a custom loathsome to the eye, hateful to the nose, harmful to the brain, dangerous to the lungs, and in the black and stinking fume thereof, nearest resembling the horrible Stygian smoke of the pit that is bottomless. So it is not that it has been liked by people over the times. It has been hated, and there have been legislations against tobacco. Nicotine is believed to be more addictive than cocaine and heroin, and it acts by stimulating and then depressing the vagal, autonomic ganglia, cerebral and spinal centers. It is used as a mood elevator, and that is the reason why the people get dependent on that. Tobacco smoke also contains carbon monoxide, which we all know has a high affinity to hemoglobin, and so it causes shortness of breath by reducing the amount of oxygen supplied to the tissues. Also, cigarette smoke contains tar, which is the sticky residue that stains the fingers and teeth, and it contains benzopyrene, which is one of the deadliest cancer-causing agents known to the world. Among other chemicals, it is surprising to know that we have so many chemicals in cigarettes, including acetone, ammonia, cadmium, arsenic, methane, formaldehyde, etc., and quite a good number of heavy metals also in the tobacco leaf, which are all actually inhaled when tobacco is consumed in the form of cigarettes. Nicotine affects almost all parts of the body. We'll see each in short, because the other speakers will be talking about all those effects over the period of the day. So in short, smoking decreases blood supply to the brain, constricts the blood vessels and causes atherosclerosis. It causes the blood to clot and develops plaques, which lead to risk of heart attacks. It can also cause gangrene. It delays wound healing, and we also have a topic today regarding osteoporosis and tobacco use. Tobacco smokers suffer more fractures due to higher rate of osteoporosis. Smokeless tobacco, that is non-cigarette forms where there is no smoke, also result in tooth abrasion. They produce gum disease. In fact, it has been advocated earlier for strengthening the gums, but on the contrary, tobacco actually produces gum disease, gum recession, and cancers of the oropharyngeal cavity, heart disease and stroke. It produces increased heart rate, blood pressure, bad breath, and a reduced sense of smell. Lung cancers, number one cause of cancer death in women in India is because of tobacco. Women's death rates due to lung cancer have risen 600% since 1950, and about 90% of all lung cancer deaths are attributable to smoking. Chewing tobacco and snuff also contains, like we have already seen, various carcinogens. So smokers are 10 times as likely to get lung cancer and emphysema as non-smokers. These are some pictures which probably we all know. research has shown that smokers infected with human papillomavirus have greater risk of developing invasive cervical cancer than non-smokers. That is the reason why Indian women have cervical cancer rates 3.5 times the national average. Smoking also causes esophageal cancer, a well-known risk factor for that. It accelerates or promotes gastric cancers. Even kidney cancer is more common and aggressive in smokers as compared or tobacco users as compared to non-tobacco users. As far as diabetes is concerned, tobacco and diabetes both reduce the amount of oxygen reaching the body tissues, which result in poor circulation. Smoking raises blood sugar level, making it harder to control diabetes, and associated with its cardiovascular effects, there is a higher risk of cardiovascular disease in diabetic patients using tobacco. So that's what nicotine, being a vessel constrictor, it reduces the blood flow and cholesterol levels are increased, arteries are hardened, and the combined cardiovascular risks of smoking and diabetes is as high as 14 times those of either smoking or diabetes alone. Second-hand smoke, which we are exposed, those people who are non-smokers are exposed to, it refers to smoke from the cigarette, which a non-smoker also inhales, or it refers to the smoke which has been exhaled by a smoker, to which a non-smoker is exhaled. It also contains the same number of different chemicals and toxins, and children especially are vulnerable to this second-hand smoke, and age 2 months to 5 years are exposed to second-hand smoke at home. So that's a very big ratio, 38% of children, and this causes so many ear infections. We have asthmatic episodes of bronchitis, and pneumonia in children under 5 who are exposed to second-hand smoke. So these incidents are increased: coughing, wheezing, asthma, sore throats, colds, eye irritation, and hoarseness, they are increased. Pregnant women exposed to second-hand smoke, they pass carcinogens through the blood to the fetus, and it causes 2 times the risk of low birth weight, miscarriage, prematurity, and sudden infant death syndrome. Finally, like Mark Twain has said, giving up smoking is the easiest thing in the world. I know, because I have done it thousands of times. So nicotine is a hard habit to quit. On a milligram to milligram basis, it is 10 times more potent than heroin as an addictive substance, and it's an overlearned behavior. Teens they start experimenting with the drug, and then by the time they want to quit, it becomes difficult. If you look at the pack per day smoker estimates, if it's a 6 doses or puffs per cigarette or 20 cigarettes per day, it amounts to 43,800 doses of nicotine per year. Few behaviors are more frequent than this, and that is blinking of your eyes and breathing. So that sums up how difficult it would be to quit nicotine once the habit is formed. Thank you all.
So then, thank you, Dr. Chavi, for nice exposition. Is there any clarifications, questions? Because this is a very interesting topic. Yes, please.
So I'd like to just add that new term has come up, that is third-hand smoke.
Yeah.
That is the contaminants, the smokers when they touch the say solid surfaces. So new terminology has come about 3-4 years back, that is third-hand smoke.
Third-hand smoke, okay.
So that is also, I just wanted to end that.
Thank you, sir. Thank you.
What is the safe number of cigarettes that one can smoke before getting malignancy of the lung?
Sir, any use of tobacco is not safe.
Anybody? So if there are, yes, please.
Actually, what is the carcinogen? Is it the tobacco per se, or when it is mixed with lime?
Sir, like we have seen, there's almost 4,000 chemicals, of which around 60 or more are carcinogenic. They are there in the leaf, and in cigarettes, the filter, the paper, everything, those also add to the carcinogens already present in tobacco leaf.
Because when we see in some of the states, the tobacco is massaged,
Yes, sir.
but there is not much high incidence of oral malignancy in those states. Whereas when it is mixed with lime, then the carcinogenic effect is enhanced.
Sir,
This has been proved by the research itself. So that is to be cleared, in this forum. That some of these states, for example, Rajasthan, they massage morning and evening since childhood, but the incidence of carcinoma is fairly less, as it should have been if only tobacco is the carcinogen. Yeah. The research says that when you add lime, then the carcinogenic effect
Sir,
of
yes,
the
sir.
tobacco
Actually,
is enhanced.
I had the opportunity to visit a nicotine factory at the place where I studied. I studied from Gujarat district Anand. There's a place there called as Dharmaj, where there's a nicotine factory. The way they extract nicotine from tobacco leaf is by mixing it with lime first. Then they treat it with sulfuric acid, and they extract the nicotine from the leaf, and then the sulfuric acid is then removed, and then they get the pure nicotine extract. So I think by adding lime, the nicotine, it helps in extracting pure nicotine from the leaf, whereas just massaging the leaf may not be releasing that much of nicotine so as to cause damage.
Yeah, that's the part.
That must be the
I
thing.
think I'll just add what was rightly mentioned was once you have this concoction where you have the tobacco leaf, you have the betel quid, you have the lime, katicho, I mean so many things which are added together, that concoction is much more potently carcinogenic than the tobacco leaf alone. But in India, since it's customary not to use it alone, especially the smokeless tobacco, so it definitely we have much higher incidence, at least in the central part of India and also in the western part where submucous fibrosis, and then subsequently you have precancerous, other lesions and cancers.
What is your experience about women smoking and their children having placental insufficiency and IUGR?
Sir, I have not gone to that literature, sir. I have not. Maybe if there's some gynecologist here who can help me out.
Because my personal experience is
Sir.
that, I work at a hospital which is a high-end kind of a hospital in Bombay, Just Oak Hospital. We have a lot of so-called sophisticated women who smoke like chimneys. Almost at least about 30% of their children, they have placental insufficiency. They go into IUGR and their children are born with much lesser weight. So I wonder if any gynecologist can tell me more about it.
Sir, as far as I know, IUGR is a very important association with smokers. And it is because of placental insufficiency, because of the decreased blood flow. And decreased blood flow reasons are the same, and coronary artery disease, placental disease,
Vasoconstriction.
vasoconstriction.
Dr. Chudamani Gopal, I was wondering about any study to show the mothers who were smokers and their babies, when these children grew up, did they have the natural tendency of going for smoking, and the other thing was, how was their mental makeup? Did they grow up as stabilized children or unstable personality, something of that kind? Any study?
I think when we are talking of a mother who's smoker, who's a stress-related person, etc., that runs in the family. And I firmly believe that when it runs in the family, it's a direct effect whether a smoker or non-smoker. The stress is the cause of the children not doing well in life. And therefore, it adds on with your smoking that these children they are exceptionally tense in life. And their stress levels are very, very high. And that's why, they tend to,
You see, You asked about the absorption of nicotine when it is massaged and when it is taken orally. See, nicotine is an electrolyte. All basic substances are absorbed more in alkaline media. So when we put it with tuna or calcium lime, not only release is increased, but the absorption is also increased. So it is not only the extraction process, but it is also the absorption. Skin being acidic in character, so absorption is less. Then other part that in your presentation, there somewhere you mentioned about the heroin. Actually, spelling of the heroin is Heroin, but there was E also. It may be a mistake, not yours. Maybe your secretary has typographical mistake, because in my department, once a letter was written, head of the department, but she wrote dead of the department. So there are so many things, because heroines are found in Hollywood, Bollywood, but not in the morphine, and so spelling is not E. Thank you very much for evoking so much enthusiasm and questions. Other part, Lasa, as you said, you see there are studies in the rodents where the mother who are pregnant dames, they are exposed to the tobacco. It was found that the offspring for 7 or 8 generations were tobacco loving, because when nicotine was put in the water, then these offsprings were taking water. There were choices: non-nicotine water, nicotine water, and these offspring were taking more water which was having nicotine, and it went generation to generation. This had been proved that the mothers who are smoking, their offsprings will be more addictive to the cigarette. So studies are there in the rodents. Thank you very much.
There's one more, I think. Last, before then we will move on. Give the mic, please.
Yes. Being basic substance, all alkaloids are.
So can we conclude that the body fluid parts that are alkaline in nature, they are more exposed or more at high risk to tobacco consumption?
Yes. You see, the pH of the mouth is 7.4. It is neither acidic nor, so that's why this calcium carbonate is combined with this in order to release more, absorb